Hi. Have you ever met someone that when you first just met them or known a friend or family, you notice some unusual characteristics? Perhaps when you're in conversation with them, they steered their gaze away from you or they looked down at their feet. They seemed to take the conversation in a direction that they seemed obsessed on that topic, or perhaps you noticed they were living in their own world. I actually am a parent of a child with Asperger's, and when he was little, I noticed some unique and different things about him. However, I couldn't quite put my finger on it, and I did think that it was my parenting skills that were causing the issues. And until I put him into a public school setting, did I notice from the teachers that he was having issues in a social setting. Then I had him evaluated, and he was roughly about 10 or 11 years old. In my speech today, I would like to introduce you to Asperger's Syndrome, its symptoms, how it can be treated, how it can be detected, and how we can best help those patients or family members that we know succeed in social settings. Asperger's Syndrome was first detected in the 1940s by a Viennese pediatrician. His name was Hans Asperger, and that's why we have Asperger's Syndrome. He noted that in some patients, autism-like behaviors, and specifically these were boys, but these symptoms were masked by the normal language and speech development. These children had issues in social and communicational skills. This masked their autism-like behaviors. In 2013, in the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, 2013, they included Asperger's Syndrome into the Autism Spectrum Disorders umbrella. Asperger's Syndrome has less severe symptoms than autism. Children with Asperger's Syndrome want to fit in socially, however, they don't have the protocol. They show lack of empathy. They may also have different inflection in their voices. My son, for example, has a rather loud, monotone voice and still does, and he is in college. There's other Asperger children that may have loud-pitched or soft-pitched voices. They also have sensory issues. For example, my son, when I took him to a concert when he was 13, we had to leave because he couldn't stand the loudness of the music, and he would cover his ears like this, and so we ended up leaving. So they have, children with AS have sensory integration problems. They also border on obsessive thoughts. They may collect things such as bottle caps or stamps or trains, or perhaps they have amazing ability to remember statistics. A major difference between Asperger's Syndrome and autism is that there is no speech delay. They don't understand irony or humor. And one thing I did to help my child when he was around 6 or 7, I noticed that he wasn't getting my jokes, I guess. I would buy him joke books, and he became obsessed with my joke books. The diagnostic criteria for AS is as follows. These children must have severe and sustained impairment in social interaction and the development of restricted repetitive patterns of behavior, interests and thoughts that cause clinically significant impairment in social, occupational, or other areas of functioning. There are steps to diagnosis, and that would be taking the child to get an assessment done by a medical professional. There are strategies to help Asperger's Syndrome. These would be cognitive, behavioral. One thing that really helped my child was behavioral therapy, and what they do in these counseling sessions, they help the child to focus on getting away from the obsessive thoughts and repetitive patterns. My son, for example, had obsessive thoughts on chess moves. He also had repetitive movements, like he would maybe move his hand and move it like this, or up, or flex it, which would be distracting to him even if he was in a chess game. So he had to learn how to control that. Also, they would have communication skills classes, which would help patients with AS, no matter the age, how to start up conversations, which is very important. Also occupational therapy for sensory integration issues. Medication, we tried that when he was 12 for about 10 days and it was a nightmare. So I decided to go the hard route and help him with alternative therapies, diet, and counseling. Finally, patients with Asperger's Syndrome, the difference I think that helps these children and adults is family involvement and friends. And the more that we as parents and outsiders know about AS, we can help the patients. In conclusion, I hope that this short summary on Asperger's has informed you on this diagnosis and how to be better informed. Thank you.